All right, good evening, everybody. I think we'll go ahead and get started. There are a few people still checking in, but I don't want to start too far after the hour so we can make sure we have plenty of time for hearing from our speakers. It's such a pleasure to see all of you here in person here at the Hemmingson Center at Gonzaga University, and those of you who are online, live streaming at home, welcome to you as well. My name is Dr. Brian Henning. I'm a professor of philosophy and environmental studies here at Gonzaga University, and I direct the Center for Climate, Society, and the Environment. It's my pleasure to welcome you this evening. The Gonzaga Climate Center was formed in April, informed by an abiding commitment to justice and care for the planet. The Center for Climate, Society, and the Environment serves our campus in the Inland Northwest by promoting innovative, interdisciplinary scholarship, teaching, consulting, and capacity building on this intersection of climate, society, and the environment. Before introducing our speakers, I'd like to begin by acknowledging the indigenous people who have been a part of this land in what we now call Eastern Washington State for more than 10,000 years. In the spirit of the Jesuit composition of place, we acknowledge that Gonzaga University resides in the homelands of the Spokane tribal people. This land holds the cultural DNA and the spirit of the first people of this place, the people of the river. It is their ancestors who are here and bring forth the power of this place, the knowledge that comes from the land. We are grateful to be on this land and ask for its support as we work to manifest our intentions during this gathering of hearts, minds, and spirits. And now, I'd like to welcome our two speakers. Our first is Amber Lenhart, who was born and raised here in Spokane area and received her master's in public health from the University of Washington. Ms. Leonard worked to improve the health of all people through local and state policy change while working for Health Impact Project, a collaboration of the Robert Wood Johnson Foundation and the Pew Charitable Trust. And most recently, she served as the Spokane Regional Health District's policy specialist. As a national expert in health equity through policy change, Ms. Leonard has worked and lectured on the health impacts of systemic racism, unhealthy housing, childhood lead exposure, disasters and climate change, and the built environment. Please join me in welcoming her. Our second speaker is Dr. Bob Lutz, who's a board-certified family medicine physician and holds adjunct faculty positions with the University of Washington School of Medicine and the Washington State University Elson Floyd College of Medicine. He received his medical degree from Temple University in 1988 and a master's of public health from the University of Arizona in 2003. Upon moving to Spokane, Washington in 2004 with his wife Amy, he served on the Spokane Regional Health District's Board of Health for 8 years, until being appointed as the health officer for Spokane County, Washington, from 2017 until 2020. He currently serves as the health officer for Asotin County here in Washington and is a member of the Washington State Board of Health, representing local public health, and is the medical advisor for the COVID-19 response for the Washington Department of Health. Please join me. I can't think of two people that I'd more like to hear from about climate crisis as public health crisis, a regional perspective. Amber, Bob.
Thank you. Good morning. Good morning, egad. Good evening, all. And thank you, Brian, and thank you for being here this evening, and thank you, Gonzaga. Full disclosure, this is the first public presentation I've given in way many years. I'm a little rusty, so bear with me. I'm used to sort of sitting behind a computer screen, as maybe many of you are. So hopefully I'll get through this. So anyway, as Brian said, today I really want to provide you sort of the foundations and the framework for where we are right now. I mean, I would suggest to you that this is obviously, as many of you believe, this is sort of an existential challenge that we're all dealing with. And as a physician, as a public health physician, I naturally see things through the lens of health. Obviously, there are many other aspects of climate change, but again, tonight we'll be really talking about what I'll provide you as sort of the framework some terms, some concepts, and then Amber will be talking louder, okay. And then Amber will be talking about sort of policies and things of that sort. So the first couple of slides are just images of the changing world. And the term I'd like to have you remember is, these are what we call climate drivers. So Arctic warming, increased heat and extremes of heat, desertification, rising seas and how they're impacting coastal communities, extreme weather events, obviously what we had yesterday, not quite as extreme as some other extreme weather events, but nonetheless more extreme weather events. And unfortunately what we've seen far too much of in the inland Northwest and in the Northwest, and again on the western states, wildfires. So when you look at how an individual or groups of individuals are impacted, this is sort of a Venn diagram, and you look at what's again, the risk. And the risk is going to be affected by an individual or community's vulnerability, by the hazards or some of those climate drivers that I mentioned to you, and then about the exposure. And I want to talk a little bit more about vulnerability. And so there are three elements that I want you to sort of consider when you're looking at how an individual or community is considered vulnerable, or maybe how they are not as vulnerable. Exposure sort of speaks for itself. Okay, the actual interactions of the individual communities with the environment and those stressors. Sensitivity, okay, again, sensitivity at the individual level, at the community level, how well they are going to be, how impacted they are, how sensitive they are, what are the risk factors, what are those unique characteristics of the community or the individual that makes her or him more sensitive. And then adaptive capacity. You know, it's interesting as you look at the language around climate change. A decade ago, we didn't talk about adaptation. We were talking about being able to try to prevent climate change from happening. Well, we've obviously not been very successful. And so now we have to look at how we adapt to what is inevitable, the changes that we're seeing. And so one of the things that I want people to realize is that vulnerability is both time-specific and it's space-specific. So this is a map of using an index called the Social Vulnerability Index. There's also an environmental component to it. And so it looks, again, at a community. And again, it has a number of different indices, but it will look at a community and how sensitive community members are to environmental stressors. And this is sort of getting a little bit more detailed. And you can see that Spokane, if dark represents more vulnerable communities, and again, you may live in some of the more vulnerable communities or maybe not, but you can see that Spokane has some very high social vulnerability, environmental vulnerability areas, thereby putting people more at risk. Think about risk and think about vulnerability as occurring on a life course. On the far left of this image is what we call the social ecological model of behavior change, but it's also how people's health and behaviors are impacted. And although we'd like to say, you know, you are indeed the keeper of your own behaviors and the keeper of your own health, the reality is that we know that health is impacted by many, many features, many, many factors. And we'll talk about this a little bit later. Realize that an individual's life is impacted differentially by where it is on a life course. Pregnant women, infants may be more at risk, seniors may be more at risk, and then maybe again somewhere in between, risk factors decrease. But think about again the risk of climate change as a function of where an individual is in his or her life course. And then in public health, we talk about a lot what are called social determinants. It's those societal and cultural factors that really impact an individual's health. So although, again, we'd like to say that you are truly a matter of clinical health and clinical access to care, we realize that really our health is significantly impacted by the social factors, the societal factors, those things that are outside necessarily of our direct control. And those are, again, those environmental factors which we have control over as a society, but maybe not so much control over at an individual level. And you can't get away from the inequality that exists and inequities that exist with climate change. You know, the reality is that every health condition that we deal with, be it in clinical practice, be it in public health, we see nothing but inequities. We can look no farther than COVID-19, and you've heard about the inequities that have hit our marginalized populations. Well, climate change disproportionately hits those individuals who are most marginalized. And so this, again, is a recurring theme that you will hear throughout the evening. So putting it all together, this is just sort of a little bit of a representation. The climate drivers that I talked about, exposure pathways, and we'll talk about those a little bit, and then the health outcomes. And on either side of this sort of diagram, you'll see those social factors, those societal factors, those environmental factors, which contribute to how an individual's health will be impacted by climate change. So this, again, you've seen this image, and if you imagine, if you will, it's those individual things in the middle, which then lead to those in the second circle, those environmental factors, which then lead to some of the health outcomes in the periphery. So populations at risk. Well, of course, children. I mean, children are incredibly vulnerable to climate change. They're vulnerable to a lot of conditions. But if you look at the sheer numbers of children, I mean, literally the millions upon millions of children who are vulnerable because of where they live and the environments in which they live, the pollution, and again, the risk factors, the climate risk factors, children are a very, very at-risk population. Looking at a couple of numbers, it's estimated by UNICEF notes that probably 2.2 billion children face a, quote, deadly threat from climate and environmental stressors. 90% of the children in the world are in areas affected by air pollution. Seniors. I think this image really speaks for itself. This was an image that I pulled from the news. It was an elderly woman who obviously has a breathing problem. She was in a wildfire down in Northern California. And so this was the tent that was put up in a parking lot. Okay, so elderly people, other medical conditions, medications that put them at increased risk, and then obviously just things like mobility, access. So again, seniors definitely a at-risk population. Are marginalized Black, Indigenous, and people of color, oftentimes because of institutional structural racism. Okay, people live in bad environments that are more at risk for climate change, for flooding, environmental stressors. So again, I think our marginalized populations, our BIPOC communities are also disproportionately impacted in this country and elsewhere. And are homeless. I mean, homeless individuals, you look at the sheer numbers of individuals who are living homeless or unhoused, chronically exposed to the environmental stressors. So not surprisingly, also a significant number of these individuals have medical conditions, which make them even more susceptible. So again, some of our more at-risk vulnerable populations. And then I would suggest to you that everyone, every individual is vulnerable to climate change. I think, just think about the heat extreme that we had this past year and talking with friends who are in their 20s and 30s. Well, you know what? They didn't have air conditioning. And all of a sudden it's 91 degrees in their home. And I think, again, although we would like to think that it's just a function of, oh, just those vulnerable populations, the reality is that everyone here and everyone on the globe is truly at risk for the changes and the health changes of climate change. So I'm just going to focus on a couple, the temperature, air quality, vector-borne diseases, and mental health. But these other ones are all, again, sort of factors that have been identified by the World Health Organization and other international organizations as health impacts. So let's first talk about heat, extremes of heat. I won't belabor, I'll let you look at the graph, but it kind of speaks for itself that as you get to the right, you can see that the temperature changes are increasing. And again, this is at the world level, and then if I look at the national level, again, significantly increasing overall temperatures. And it's not much. I mean, you say, well, it's a degree, it's 2 degrees, but 2 degrees makes a huge difference in the continuum of how our Earth is warming. And yet again, just another graphic explanation of the same type of presentation. Again, you can it sort of speaks for itself. Urban heat islands. This is an image of Atlanta in the summer. And as you can see, the red or the colors towards the one end of the spectrum representing higher temperatures versus blue in the cooler colors. Urban versus suburban. More greenery. And again, cooler environments. This is just a map of this past year and the extreme heat that we saw in June. And again, I think the colors speak for themselves, but the numbers are really sort of telling. If you look at the numbers of individuals who succumbed to heat in California, Oregon, Washington, and British Columbia, it was, again, a couple hundred. Washington alone had 112 individuals who succumbed to heat. And you look at the demographics, and these were unfortunately seniors more often. They were seniors and they were men living by themselves in apartments. So again, risk factors. But again, as I would suggest to you, and as I shared earlier, I think all of us are susceptible to these types of heat extremes. And then again, you can just sort of see, again, the graphic representation of the number of deaths. Look familiar? Yeah, unfortunately, I think we've all become too familiar with this. I remember, I moved to Spokane, as Brian said, back in the early 2000s, and, wow, glorious weather in the summer. And summer, wow, August, September months. And then all of a sudden, 2012, 2015, what happened? And for those of you who weren't here, 2015 was a heck of a year. And although this image is more recent, we had some of the worst air quality in the country. And why? Because of significant wildfires that were really hitting the Northwest. Long-term drought, forests that are unfortunately very unhealthy, make them very susceptible to wildfires. And wildfires produce a lot of toxins, we talk about particulates, but you also see other air quality issues such as ground level ozone, and particulate matter. We talk about something called PM2.5s that I'll spend a little bit of time talking about. But this, unfortunately, is what we have seen. And I hate to say it, but as you've heard, maybe the 5th season in the Northwest may be indeed wildfire season. This is a table that I pulled from Spokane Clean Air. And you can sort of see by color coding the number of unhealthy days. And this goes up through 2020. I was able to look and get data from Spokane Clean Air Today. In 2021, we had 8 days that exceeded the range, specifically of what's called PM2.5s, and I'll talk about that in a moment. And then this is just another graphic representation, and again, the color code speaks for itself, so the darker colors are poor air quality. Green is good, but when you get beyond that, you start getting into really poor air quality. This graph is a little bit dated, but irrespective, I think you can still get a sense of the fact that we are seeing hotter temperatures in the Northwest. This actually, again, is looking at western states overall. And about a 2-degree temperature change has a huge impact. And then the number of acres burned. And again, this is only back to 2019, but last year, actually this year, 1.87 million acres burned, which was a little bit greater than last year, which was 1.4 million acres. We actually have a cabin up in on the east side of the Cascades. And I don't know if you've ever had level 2 or level 3 evacuations, but it's very disconcerting when you go to your cabin and all of a sudden you find that DNR has dug a fire line behind your cabin. And you're not sure, you may make your cabin or your home fire-wise, but you're still not sure. And that's also what I'm going to talk about, the mental health aspects of climate change in a moment. I mentioned about PM2.5s. I love this graph. I've used this graphic. I've used it a couple of times. Again, the PM2.5s, that little pink circles, why is that so bad? Okay, incredibly small enough to get down deep into the lungs, and get down deep into the lungs enough to get into the vasculature, your blood system. And it travels throughout the body and it causes inflammation. And so although we think about, well, the smoke, it causes problem with the eyes and the nose and the ears, the reality is that wildfire smoke and PM2.5s, other sources beyond wildfire smoke, but irrespective, incredibly toxic and unhealthy, not only for cardiorespiratory system, but also because of chronic inflammation, increased risks of stroke. We see just a whole host of different problems associated with wildfire smoke. Mosquitoes, or what we call vectors. And these are just some of the diseases which are very common and becoming more common. You know, if you think about a lot of these diseases, you may sort of associate these solely with tropical communities. Malaria, okay, you're not going to see that in the United States, or maybe you're only going to see it in the southern United States. But we actually see malaria in other northern states now because of the fact that as temperatures have increased, the mosquitoes have moved farther north. In Spokane, we started identifying West Nile virus. And that was, again, something that we had never seen before, but now we know that it's truly endemic. And so we don't even bother, in many respects, going and looking at ponds for mosquitoes to identify West Nile virus carrying mosquitoes because we know they're there. And so therefore people should just have that as a concern. I also mentioned tick-borne diseases, and these are just some of the many, many tick-borne diseases. But again, all of these are increasing because of the fact that, hey, you know, bugs like warmer weather. And as the temperature gets warmer, we're going to find ourselves associating or interacting with these vectors much more commonly. Recognize this? This has been my life for the last 2 years, seemingly. But this is, again, a reflection of the fact that what are called emerging infectious diseases, many of which are borne by animals, are becoming much more common. So if you think about this, if you think about this coronavirus, if you think about other coronaviruses such as SARS, such as MERS, they were, again, emerging infectious diseases, meaning that, well, they may have been present, or maybe they were not present before, but because of changes, they are more now. Humans are becoming more interacting with animals that are carrying these. Think about some of the incredible pandemics. The plague, you look at COVID-19, you look at some of the other bubonic plague, you look at some of the other major sort of plagues throughout the centuries, and they have been primarily either borne by vectors, mosquitoes, or, as I said, zoonoses, animal-borne. If you think about influenza, influenza is a zoonosis, okay? It actually comes from domesticated animals and then is transmitted to humans. So as the climate warms and as we become more are interfacing with either vectors or emerging diseases in animals are more common, we're going to see more and more of these types of diseases. I want to talk about mental health. I sort of alluded to it earlier, but any of you who have found yourselves, oh wow, what's the AQI today? Oh, the AQI today is, oh, it's worse than it was yesterday. What was it last week? It really wears on you. And so we're seeing that climate change is affecting people. It's affecting people from the standpoint of having more problems with depression, anxiety. Interestingly, but maybe not surprisingly, we also know that it increases people's anger, and you find more violence associated during hot weather. And it also aggravates people with underlying mental health issues baseline. Many of the medications that people are on for mental health are very sensitized by high temperatures. And so you find that, again, mental health, not only for people who don't typically have mental health concerns, or conversely, people who have mental health issues, climate change and the changes thereof are only making things worse for them. Well, what do we do about it? Now, Amber is going to talk a lot about things that we can do, but I just want to give you a little bit of a framework. This is from the CDC. BRACE, this again is looking at it from a sort of a scientific basis. The letters sort of stand for an acronym, and you can sort of read them for yourselves, but that's how at least the CDC is now proposing that we collect the data and we look at how to affect communities, improve their resiliency, and try to, again, adapt to the changes associated with climate change. I put this forth earlier on. I mentioned there was a social ecological model, a circle. I like this. This was something that I adapted from Secretary John Weisman, who was previously the Secretary of Health in Washington State. And the reason I like this adaptation is because at the base, it puts policy. And what I'd suggest to you, and what Amber will talk about, is that the way we can really affect the most change for the greatest number is by addressing the policies that affect health. But this is where you come about. This is where you come into this. These are all photographs I just pulled from the most recent climate change conference. And we need to speak up. At the end of the day, policy will change if we're willing to make it happen. But too oftentimes, because of systems that are very entrenched, oftentimes economically based, politically based, things don't change. So the only way that I would suggest to you that we can really affect change is by being active in our communities and being active at the local and maybe even the state and the national level. Some of these images are just so powerful. I mean, obviously indigenous people, as I shared with you, deforestation, and kids. You know, I was so excited when I would see children, although I'm disappointed that we have to have children protesting about climate change, but this is their future. And they need to be able to speak out. We need to be able to help to create environments that will make a healthier environment for them in the future. And this is my favorite one. I just want to finish with this quote. This is a quote from the Institute of Medicine about public health. And when I've given presentations in the past, I always end with this quote, because for me, as a public health professional, they say, well, you know, this is your responsibility, this is your world. And I would suggest to you that it's a societal responsibility, it's a collective responsibility, and it's also something that is all of us need to be involved with to affect the health and the environments in which people live so that they can truly be healthy. So for me, it's a collective responsibility, it's a collective action, and it's a societal need. And again, it's affecting the environments that people live. So I'd suggest to you that if you care about your neighbor, if you care about the environment, if you care about your community in which you live, then you're a public health professional, you're a public health person. And so I would just ask you, when you go about your daily lives and the work you do, look at things through a public health lens. Because again, I think if you do, it gives you a little bit of a different perspective about how you live your life. Just some resources, and thank you.
Thank you so much, Dr. Lutz. We're going to save questions until the end, and so we're going to hear from Amber Lenhart now. And there we go.
Okay, thank you. Hello, everybody. It's such an honor to be here at Gonzaga in front of you and talking with Dr. Bob, one of my favorite people to present with. My name is Amber Lenhart. I am going to be looking at my notes while I talk because, like Bob said, this is also my first presentation to three-dimensional humans in like 18 months. So I'm a little bit anxious, and I'm just going to be looking at my notes. So please bear with me. I'm used to two-dimensional squares. This is very strange. I grew up, as Brian said, in the area, in Millwood, actually, and I returned to Spokane 4 years ago after about 15 years away. My background is at the intersection of policy and public health. After finishing my master's degree in public health at the University of Washington, I worked for the Health Impact Project, which Brian said was a collaboration of the Robert Wood Johnson Foundation and the Pew Charitable Trust. It's based in Washington, D.C. And our focus there was on improving the well-being of communities across the nation by bringing health into decision-making conversations. Now, our well-being is shaped by many factors: our genetics, the food we eat, where we live, whether we exercise, eat healthy, or if we're sedentary and we smoke. Policies in sectors like education, criminal justice, and housing affect those factors and ultimately shape our health outcomes. So since there's so many sectors that determine our health, I had the opportunity when I was at the Health Impact Project to work with teams incorporating health into all kinds of policy and planning initiatives, from full-day kindergarten in Nevada to native-owned fisheries in Hawaii to frac sand mining in western Wisconsin. Occasionally, I had the chance to work on climate change policies. I helped a team in New Jersey assess the health implications of stormwater infrastructure and community buyouts after Superstorm Sandy, if anybody remembers that one. I worked with folks in Louisiana to understand the health equity impacts associated with developing a new natural gas plant in underserved East New Orleans and how our changing climate modifies those impacts through changes in sea level and subsidence. So after moving back to Spokane, I did work at the Spokane Regional Health District, which is where I met Bob, on data and policy. And I've been a freelance health in all policies consultant for the last year. And for the last 2 years, I've also been facilitating a collective impact project in Seattle's Lower Duwamish Valley to ensure that all people there can breathe clean air, all the while considering how climate change plays a role and changes our efforts in the future. So as I said, my specialty is the intersection of health and policies. I'm a believer in health in all policies, and as such, I know just enough about many things to be dangerous and pretty good at trivial pursuit. But I do want to offer the caveat that climate change is not my area of expertise, it's policy. So I am going to focus this presentation on what public health policy approach to climate change, or what I'm calling a health in all climate change policies approach. I just made that up. I think it's going to catch on. So what this could look like across the sort of causal pathway that Dr. Lutz described of the drivers of climate change leading all the way to health outcomes, as well as within that socio-ecological framework that he offered. And I will present some specific examples locally, regionally, nationally, globally, and then end with what you can do now to make an impact. As Bob described, climate change impacts our environments, ecosystems, and communities. It affects the water we drink, the air we breathe, food we eat, places we live, and the health impacts of our changing climate are very real. The situation looks different around the globe. Too hot, too cold, too much water, too little. Locally, we've seen changes in wildfire seasons and more extreme weather. Yes, wildfires and temperature extremes are a natural part of life, but climate change loads the dice and increases the odds that these extremes will happen. So we know that climate change has causes, greenhouse gases, natural trends, human activities, and impacts that ultimately lead to those health outcomes that Bob described. And those health outcomes might be disproportionately distributed in our community, contributing to health equity, like Dr. Lutz described, as far as different populations being more susceptible or vulnerable. This is another way to look at that collection of rainbow circles that was on the flyer for this event and in Bob's slides, just pulling it through like a pathway. I'm going to call this roadmap a causal pathway going forward, so that sounds kind of jargony, but that's what I will say. This spaghetti diagram behind me might look like a complicated mess, but to me, it looks like a treasure map of public health policies. There are opportunities to intervene all across this causal pathway, from addressing the root causes of climate change to adapting to and mitigating its direct and indirect impacts. We can also look at opportunities to address the situation at the various levels of the socio-ecological model. This is a framework for prevention, as Dr. Lutz described, and it tells us that we can address health issues at the individual level through changes in knowledge, attitudes, behaviors. At the interpersonal and organizational levels, we can do it at the community level through collaboration and local decisions, and at the public policy level, locally, nationally, and globally. All of this to say there are so many opportunities for solutions. So I will provide some examples of what a public health policy approach to climate change looks like across this causal pathway, as well as within the socio-ecological framework. I'll start with the big picture, upstream public policies globally, nationally, and locally. Just this week, the Glasgow Climate Pact came out of the UN Climate Change Conference in Scotland. The pact includes agreements to phase down the use of coal, reach zero net emissions, reverse deforestation, shift energy to renewable sources, increase electric vehicle manufacturing, and finance mitigation and adaptation. A person from Spokane, I don't know if you're here, it wasn't me, actually had the chance to attend the conference and watch the policymaking in real time. If you're here, you can tell us about it later. At a national level, the president's infrastructure bill includes $50 billion for climate resilience and weatherization, providing financial resources for communities affected by or vulnerable to disasters, funding for research on wildfire modeling and forecasting, and increased funds for the Federal Emergency Management Agency, or FEMA, to come in and help communities after disasters. It also includes $65 billion for clean energy and grid-related investments related to electricity and utilities, and $7.5 billion to increase infrastructure for electric vehicles. On May 7th of 2019, Washington State Governor Jay Inslee signed into law the Clean Energy Transformation Act, lovingly called CETA, committing the state of Washington to an electricity supply free of greenhouse gas emissions by 2045. The law provides safeguards to maintain affordable energy, utility rates, and reliable service. It also requires an equitable distribution of the benefits to transitioning to clean energy for all customers, and adds and expands energy assistance programs for low-income customers. You actually have an opportunity to be involved in this work locally, if you're interested. As part of the requirement to ensure all customers equitably benefit from the transition to clean energy, our local utility company, Avista, developed an equity advisory group that's made up of customers representing historically excluded communities. You can join this group to provide guidance on equity in clean energy. If you are interested, I would direct you to myavista.com/CETA to complete an interest form. Little plug there. So, and I think we're mostly aware of the things that we can do as individuals to try to work upstream on this. We can reduce our use of resources, if we can, switch to more efficient light bulbs and appliances, adjust your thermostat, contribute less to greenhouse gas emissions. You can even drive less if you can, maybe take public transportation, walk, bike, or scoot where you need to go. Think about what you eat and where it came from. If you can, try shopping at your nearest farmer's market in the spring. When you support your local economy and lower air pollution from transportation through going to your farmer's market, you can work to support this work. And also eating more vegetables and less meat can save money, protect your health, and cut down on greenhouse gas emissions. And plant a tree or a few. Obviously, trees help clean our air and provide us with oxygen to breathe, but they also provide much needed shade for cooling yourself or your home, which can actually lower your energy costs. And using native plants and vegetation can help protect against soil erosion and water conservation, or can help with water conservation. So now let's look at the other side of the problem. Now we're post-climate change. These are examples of how we can address the implications of climate change, wildfires, floods, storms, and interrupt the pathway to those health outcomes. I don't really have an example of a global or national approach to adapting to climate change or mitigating its effects because there aren't really examples at the national level. Like the impacts of climate change, many adaptation efforts are also regionally specific. But we can look to examples in other parts of the nation, including the use of green infrastructure. So historically, communities use gray infrastructure, pipes, tunnels, sewers, gutters, to remove stormwater away from where we live, to treatment plants, or even straight to local water bodies. In many areas, our gray infrastructure is aging. The capacity to manage large volumes of stormwater is decreasing in areas of the country. So to meet this challenge, many communities are installing green infrastructure systems to bolster their capacity to manage stormwater. By doing so, those communities are becoming more resilient and achieving environmental, social, and economic benefits. So examples at a sort of local neighborhood scale could include a rain barrel up against a house, a row of trees along a major city street, or the greening of an alleyway. At an urban scale, I just skipped that one. At an urban scale, it could include, sorry about that. At the neighborhood scale, green infrastructure could include acres of open park space outside a city center, planting rain gardens, or constructing a wetland near a housing complex, residential housing complex. At the landscape or watershed level, examples could include, big green open spaces, riparian areas, restoring wetlands, or regreening steep hillsides, installing different type of infrastructure like porous pavement. So when green infrastructure systems are installed throughout a community or a city, they can provide cleaner air and water, as well as significant value for the community with flood protection, diverse habitat, and beautiful green spaces. Community planning, comprehensive plans, and design standards can help make sure communities and neighborhoods are protected and more resilient. I don't know if anyone in here has dreams of becoming a planner, but planners are also part of the solution to climate change. Like Bob said, everyone in this room is in public health. Community planners in some communities look to zoning changes to reduce the likelihood of living in a home in a floodplain or an area particularly vulnerable to other climate change impacts like excessive heat. Another state or community example is weatherization. If you've heard of weatherization, it usually involves finding some sort of qualified household, maybe usually low-income families, and making their homes more energy efficient at no cost by doing things like adding insulation to an attic or weather stripping around a door to make sure that that heat isn't leaving your house, or changing thermostats to a smart thermostat. States use weatherization funds provided by the U.S. Department of Energy Weatherization Assistance Program to help recipients cover heating bills and invest in energy efficiency actions that also lower costs. So this can make your home cooler or warmer depending on the seasons, improve your indoor air if we're dealing with smoke, and ultimately improve our health outcomes. Some communities have formed shared use agreements with local school districts, giving them the ability to open school spaces like gyms to the public for daytime shelter if you need to escape from heat extremes or cold extremes or the smoke and the poor air quality. Just another example of how communities can be part of this. So while we're talking about wildfires, let's come back to there. Let's consider some local policy examples. More frequent wildfires and poor air quality are expected to increase respiratory illnesses in the coming decades. Wildfire smoke can be severe, particularly in communities in our region. At a state level, our Department of Natural Resources works to prevent, predict, and track wildfires and prepare communities for disasters. At the organizational or community level, our utility company, yes, back to Avista, has a wildfire resiliency plan. So an example of a strategy that's in their plan is to replace or strengthen electric infrastructure, especially in fire-prone areas, to protect it from possible damage and reduce the likelihood of spark ignition sources. So if you can imagine power lines traveling through the woods, bringing electricity to your home, if a forest fire takes down those power lines, you might be dealing with a power outage for some time. As an individual, you can take steps to protect your home and yourself from the effects of wildfires. Dr. Bob mentioned a couple at his cabin, but you can clear brush and wood away from your home, manage vegetation around it. That can help protect it. And of course, air filters and certain types of face masks can reduce your exposure to harmful smoke. As I've said, the impacts and face of climate change looks different in different parts of the globe or nation. But whether we're dealing with wildfires, excessive heat, winter storms, or hurricanes, this is an issue that affects all of us. Like with COVID-19, some individuals in our community are more susceptible to the harmful impacts of climate change. Bob mentioned a number of examples. Our unhoused neighbors struggle to find shelter from smoke and weather. Low-income households are less able to bounce back financially from a disaster. Neighborhoods that are more urban, where communities of color might be greater, typically have fewer trees or the necessary infrastructure for climate resilience. As such, we each have a responsibility to our community and to the future of our community to take action. Reiterating what Dr. Lutz said. So I just want to share my key takeaway points with you. If you just take 4 things away, these are them. First, climate change affects health outcomes. That's really obvious. It affects everyone's health outcomes. There are many opportunities to address climate change, both upstream in reducing or reversing the problem, and downstream, preventing those health impacts and their disproportionate burden on certain populations. We can do this at the national level, in our community, within our organizations where we work, and as an individual. We all have a role to play, not only to reduce, reuse, and recycle, but to use the power of our voice and our vote. You can write letters or provide public comment to decision makers about the impacts of climate change and your interest in preventing it and helping people mitigate its effects. You can submit letters to the editor in the newspaper to draw attention to the issue. And you can use the power of your vote to elect individuals who care about climate change and public health. And lastly, and I think this is an issue that deserves more conversation, and I'd love to hear thoughts, actually, if we have a chance, from folks in the room about the implications of this and what we can do as a community. But as the pandemic has shown us, people in our community without social connections and support suffer the most. Bob also gave an example of, in the heat events, the folks who were passing away being older men who lived alone. Communities that work together, help each other, love their neighbors, and act in the best interest of the entire community bounce back from disasters and are more resilient to threats. So say hi to someone new, wave to your neighbor. Climate change affects us all, and we all have a role to play in the solutions. And that is all I have, so thank you. I think that here's my contact info.
All right, so we do have some time for Q&A. I'd like to start with a couple of questions from students. Kayla, if you can black the screen for me. So if you have a question, feel free to raise your hand and one of the volunteers will bring the microphone to you. So any students that start off with a question? And so if I could ask you just to sort of repeat as you understand the question, if you could.
So you said that communities that implemented green infrastructure saw an ecological and economical benefits from doing that. The ecological makes sense to me, but I'm curious how the economical impact comes from that. Because for me, it seems like switching to a green, maybe a park over concrete would be more costly. But I'm curious to know where that economic benefit comes from.
Yeah, great question. Thank you. So to repeat the question is around green infrastructure. I mentioned that some of the benefits to the communities for green infrastructure include economic benefits. So the question is, what are those economic benefits? Yeah, you're right. There is an upfront cost. The upfront cost might seem like a barrier, but when we don't have floods affecting our buildings, when I lived in DC, my basement flooded every time it rained, and all my stuff would get wet. That affected me financially. The Starbucks would flood. They'd have to put sandbags out. My Starbucks on King Street. That affected their finances. Just by being resilient to disasters and not being so affected by them when they happen, I think that's where we can save money. But I would take a look. There's probably some good resources out there on that know more than I do.
Yeah, I guess I'd just sort of echo what Amber said. I think, change doesn't necessarily just happen overnight, and by definition, it's going to probably cost. But you look at the immediate cost and you look at the long-term benefit and the long-term savings. So for example, you mentioned about a park. And think about, and I don't know the numbers off the top, but think about the value of street trees. Amber mentioned, for example, the fact that if you plant a tree, not only do you, obviously it's got all the benefits that trees and green infrastructure play, but also decreases, it's been shown to decrease the temperatures in your home. I'm really excited. The Lands Council, I don't know if you're familiar with the organization, but the Lands Council is working closely with urban forestry in Spokane to plant, I forget how many thousands of trees. I had a chance to plant trees with them this fall. And so again, I think, your point is well made, but understand that the benefits may not be immediate, the costs are, but at the end of the day, the cost savings is going to be significant.
Other questions from a student before we go to the community? Anybody else? Give you students a first chance to jump in. All right, anybody else, feel free to raise your hand and we can get you a microphone to ask a question to either of our speakers. It's coming right there.
Yeah, I'd like to know how you would rate the city of Spokane and maybe Spokane County on trying to change and mitigate the climate change.
Okay, I'll repeat the question. The question was, how does Spokane rate as far as policies, planning, preparedness for climate change? Am I getting the question right? Good question. It's interesting. Politically across the country, everything is different. When we were working in New Jersey after Superstorm Sandy, we couldn't say climate change. We couldn't use those words. We had to talk about the symptoms, subsidence, drought, flooding, rain. It was very frustrating. So now here in Spokane, we can talk about climate change. There's so many people here. Like the fact that this is happening gives me hope and makes me think that Spokane's doing well. I think that there are examples of communities that are doing much better, that have much more green infrastructure, more resilient communities. It's a good question. Spokane has lots of very healthy policies in place. Whether they're climate change adaptation policies, I'm not too sure.
I guess I'd say it's a work in progress. I mean, I've been here now 16 years. I remember back in 2000, when I moved here in 2004, I said, this community has just an incredible amount of potential. I saw, again, there was a focus on what was called centers and corridors. There was a focus on building smart and really focusing and not expanding. I had come from Tucson, which is suburban sprawl hell. I lived in a cul-de-sac community where we had what were called snout houses. So you essentially drove into your garage and you never saw your neighbor. And this is, again, this is an older community. It's got a lot of potential. I think that, we continue to see a community with a lot of potential, but not yet achieved. I think that, as Amber said, what a great opportunity that Gonzaga has provided Dr. Henning and the community to really have these kinds of conversations. I think, you look at some of the policies that the city council has put in place, and Brian's been influential in making that happen. So you look at the fact that we have I forget what it's called.
Sustainability Action Plan.
Exactly, a Sustainability Action Plan. I don't like the acronym SAP, but that said, I mean, we've got a plan. Now, the work's in front of us. And how do we actually actualize that? One of the things I'm excited about, as Brian said, I work for Department of Health. And one of the things Department of Health is looking at are communities that have plans, and then how to actually actualize them. So plans can sit on a shelf. Unfortunately, too oftentimes they do. But how do you actually start to implement some of the steps in that plan? And so I'm excited that, again, The city council saw fit to vote and support that plan. That was a work, that was an opus that took years and a lot of community effort and a lot of people to really make it happen. But a plan can't sit on a shelf. And that's where, again, you as community members need to be pushing to actualize the plan. Otherwise, it's just going to get dusty.
I have a question related to that for either of you. Last summer, I noticed that we needed to, for the first time, have not only cooling shelters, but also clean air shelters. So we are used to talking about needing to have a space for, especially the unhoused, to be able to survive the winter. It seems like now we're in a situation during the summer of needing to have a space for them to be able to have healthy enough air and to survive extreme heat. Do you feel like there's a plan yet, and resources and planning in place in Spokane to do that, or is it still a little ad hoc? Do you know, either of you?
Well, I don't know, Bob, you might know more, but I would say that there are great opportunities to do so. We've got the new Shaw Middle School. I worked on a project in Arizona where we got a school district to enter a shared use agreement with the city so that the community could use the school kitchen, the school garden, the gym as a shelter if needed. Shaw Middle School would be great for that. Like, we definitely have the infrastructure here to start to do some of these things. Is there, I don't know.
I guess, again, where I would where I would post my comments. This heat extreme this past summer showed us that we don't have the plan in place. I mean, that's the reality, and I'm known for speaking the reality. I think at the state level, we didn't have it. You look at what can I say about 112 people dying in this state because of heat? We lost 7 members in our community to heat. Why? We knew days in advance that it was going to happen. We didn't do anything. Fie on us. Shame on us. So I think that we need to be able to learn from our mistakes. One of my sayings I've said is, lessons learned can't be lessons forgotten. We learned a lesson this year. We learned a lesson that we don't have the infrastructure to support significant climate change adversity. We found that we have vulnerable people in our community, but as I shared with you, everybody's vulnerable. And we need to have a plan in place, because that's going to happen again. It's going to happen again. And whether it's a heat extreme or a cold extreme, we need to have a plan in place to provide shelters, to provide resources for community members that are adversely impacted. Lessons learned can't be lessons forgotten.
I just want to add to that, Bob. That was, yes. I think, too, that there's opportunities to learn from what happened to inform this new plan, or a new plan. We opened, the shelters for heat and smoke, and not many people utilized them. But why? I think that's a critical question to ask, is why didn't people use the shelters? To understand how can we make them more useful and usable in the future. I think there's a lot of lessons learned, like Bob said, from this year.
Hi, so I have a question for you guys. Climate change at large seems to be such a politically tied issue, especially right now. How can we go about depoliticizing this so that it can be much more of a world recognized issue that we all need to be facing together right now?
Yeah, that's probably the billion-dollar question. It's not a million-dollar question. We live in a politicized society, and it's a globally politicized society. At least now we acknowledge that climate change is happening. There's still some disagreement as to the causes, but at least we're acknowledging the fact. You can't deny the fact that it's happening, although we've been in denial as a society for far too long. I'm glad that we're having these types of conversations. everything we're doing right now is politicized, unfortunately. I should be speaking louder. I apologize, Brian. I mean, it's a political world in which we live, and it's oftentimes economically driven. You know, I mean, look at big coal. Look at coal in this country. I mean, one of the, you're not old enough to remember, but for me, one of the memories of growing up was seeing the Native American crying by the side of the road as as pollution. Well, another really vivid memory of mine for commercials is the Sierra Club's No More Coal. And every time I turn on a light, I think about the fact that I'm burning a chunk of coal. And I grew up in Pennsylvania. I grew up in coal country. My pappy was a coal miner. He died of black lung. So that's what put me through school. And we also know that it's a significant contributor to climate change. You know, so how do we get through the politics? How do we get and look at the science and realize that all of our lives are being impacted? And the longer we kick the can down the road, the longer we kick the can down the road. And then I think of those little kids who have years in front of them, have decades in front of them. You know, that's our future. Is this the world we want to create? I would argue not. You know, so again, I think that's where we need to have our voices raised. We need to be really outspoken and call for change. And, you know, act locally, think globally. Because again, every person can have an impact. And by just speaking out, by, as Amber said, make your votes count. You know, make your votes count. We can have an impact, but it's going to take time. But we also don't have an infinite time in front of us.
For anyone who is interested in climate change and having conversations, you know, with outside of this room, with others, with people from different perspectives, the Frameworks Institute does research into issues like climate change or childcare to understand how people from different political perspectives view an issue, what values they associate with the issue, and what values actually bring them along, like get them on your side. So I think Frameworks has some good tools around communicating about climate change, communicating it as a social responsibility, an economic issue, a health issue that can help. But I would point you towards the Frameworks Institute for not only climate change related communication resources, but really any sort of hot political topic that you want to talk about in a calm, cool, and collected way with your friends.
I just add quickly before we take the next question. It is political, so treating it as though it's not only serves inaction, unfortunately. So becoming active and joining others in doing so, trying to help create collective action in some of the ways that have been discussed, I think is really key. I know there's a lot of interest in avoiding acrimony, and that's good. But the types of systemic changes that are needed and the speed at which they're needed are going to require us to just try and lean into that a little bit more than we're comfortable doing. Not in order to be political or to be controversial, but in order to try and bring about the systemic changes that are needed. So we need to advocate, and we need to be clearer about it. The world just got together in Glasgow and couldn't agree not to continue funding subsidies for fossil fuels. We couldn't even agree not to subsidize fossil fuels, right? So the amount of change that's needed is considerable, right? So I think we need to be willing to join others in collectively advocating. There are a lot of good groups in Spokane doing that, by the way. 350 Spokane is really active in the space. So if you're a community member and interested in joining, collective action and efforts to try and advance action at the regional level, 350spokane.org is a good group. Sunrise Spokane is part of the National Sunrise Movement, which is a youth-led organization. It's primarily led by high school and college students here in Spokane. And although it's really hard to affect what goes on in Glasgow at the UN, it's actually quite doable to affect what's going on locally. So if you want to have agency, you want to have hope, and you want to feel like you're making a difference and you can make a difference, I would say really lean into the local level. Local, regional. It's small enough to affect. Spokane is big enough to matter, but small enough to affect. And Gonzaga's big enough to matter and small enough to affect. So working on campus, working in the community are really good ways of avoiding the despair and grief that frequently attends this sort of work as well, at least if you're like me. Okay.
My question is related to what you just said. Does the city of Spokane actively encourage leaders of various sectors, including the educational sector, the religious sector, and does the city support these groups that are involved in this climate crisis issue?
So the question is whether or not Spokane has groups, whether Spokane is supporting citizens' efforts to advance climate action at all these different levels. Is that your, so happily I would say yes, actually. For the last 2 years, there's been a citizen-led process called the Sustainability Action Subcommittee that, although it's had help from different aspects of city government, has been a citizen-led process. It's involved businesses, involved Avista, it's involved people from universities. A student of Gonzaga's has been helping to staff that city council committee. So that work over the last 2 years led to then the Sustainability Action Plan that was just passed a month ago here in Spokane. So as Dr. Lutz mentioned, though, the question now is whether or not this really interesting plan that was developed with a lot of broad community participation gets to be starting to be implemented. And this is where the really hard work now happens, is whether or not City Council can work with the mayor's office, whether or not they can work with our utilities, whether or not regional partners and businesses will participate, right? So this is actually where the hard part happens, and where all of us should be participating even more actively is helping to make sure the resources are there so that this plan, the Sustainability Action Plan, which you can find on the city's website, is actually implemented. So if you go to my.spokanecity.org/SAS for Sustainability Action Subcommittee, you can find the city's current plan, and it's only a month old.
I would add that the one thing that is missing, there is this great citizen-led work, but the thing that is missing is a agency, multi-sector work group or collaborative of some sort to bring in those sector partners that you mentioned. Whether that would take place at the city level or the regional level could be seen. That is typically a role for public health, to bring those communicators together, those sectors together, get everybody on the same page, understanding the issue and the health implications, and planning for interventions going forward. So hopefully that's something that we would see public health doing in the future.
One more question? Oh,
We have two.
two? Okay.
Hello. So you were talking about green infrastructure earlier, and that there's a large upfront cost. And I think we see that with a lot of ways in which we try to combat climate change. How do we convince politicians and businesses to invest in these ways to combat climate change, despite the large upfront costs that they will have to pay?
I mentioned that I used to work with health impact assessments. Health impact assessments and tools like it, we call them health in all policies approaches, I think are a great way to bring decision makers on your side for things like this, because we can point to the health cost at the end and say, if we do this now, maybe it costs some money to put in this porous pavement and solar panels or whatever it may be, but that in terms of the return on investment to our health as a society, that will much outweigh those upfront costs. Does evidence have the same strength that it did when I was doing health impact assessments 5 years ago? I don't know, but that's my hope, is that we could use tools like that to just provide the evidence of that more long-range return on investment.
Yeah, I think, as Amber said, we can look at data. I also think we have to find leaders that are willing to take a risk. And, again, I think of Leonard from Patagonia. and I can never pronounce his first name. But I mean, he invested, he put monies towards environmental causes. There's a business who, again, there's a leader who is leading by example, putting money to really affecting change. And so sometimes it takes organizations. I think locally, Amber has talked about Avista. It's a power company, but it's a power company that's putting money into building infrastructure to keep people healthy. And so again, I think you have data, and then also times it takes leaders to really sort of see the future. It's also difficult from a health standpoint to project what I'm trying to prevent. So I can say, okay, fine, we can do this, and based upon modeling data, I will save X number of lives, and it's very theoretical. And so that's where, again, I think when you start to have inspirational leaders, when you look at data, but when you also look at advocacy, just make it happen. It's the right thing to do. I mean, at the end of the day, for me, I say health is an asset. It's an asset that allows everybody to achieve his or her potential. And that's, again, I think that's what we're trying to do. That's public health. We're trying to provide opportunities for people to achieve their potential. And it's a collective effort.
That's a great place to end. Let's go ahead and thank our speakers.
Sorry.
Caleb, could you bring up the slide? Before you start standing up, I just wanted to share with you that the Climate Center is hosting a couple of other events. Let's see, it's still showing that one. So next semester, we have 3 events scheduled. 2 of them, you'll notice, are on climate change and fire. They should be quite good, so please consider registering for these events. And then one I'm especially excited about, all of them, but Dr. Robin Wall-Kimmerer, the author of Braiding Sweetgrass, will be giving a virtual talk on February 17th. We're co-hosting with the School for Leadership Studies. And Scott Hokinson on March 7th. Scott is helping to rebuild Malden, Washington, which, if you don't know, on September of 2020, burned 80% of the town burned to the ground because of a fast-moving wildfire on Labor Day, just southeast of here. And so he'll talk about lessons to be learned for small communities. So I'd encourage you to come to our future events. You can find also past events on our YouTube channel. This event has been recorded and will be posted on our YouTube channel for future reference. Thank you all for coming, and hope to see you again soon.